As COVID-19 cases surged this summer, some people have been treated with monoclonal antibody therapy, but the treatment is limited here in Kentucky. And according to Governor Beshear, there is a supply shortage.
That thing you're counting on might not be available. What is available, and there are no supply issues at all, are these vaccines.
Governor Beshear says instead of waiting on the monoclonal antibody treatment after testing positive, people should just get vaccinated.
But as the country faces shortages of the therapy, some facilities are working to try and treat more people with it. Chelsea Jones reports.
Michelle Sawyers suddenly felt terrible.
I was coughing, I was sneezing, I had a headache from Hades.
After learning about a treatment that worked for her friend, she wanted it too. It's called monoclonal antibody therapy.
So then I started inquiring about it around here locally. Turns out you have to get a doctor's order.
She says scheduling an appointment wasn't easy, something that State Health Commissioner Dr. Stephen Stack briefly touched on.
So folks, it's a lot easier to get a vaccine than it is to get monoclonals, and it's a lot more complicated to give monoclonals to folks.
According to the FDA, monoclonal antibodies must be given to COVID patients within 10 days of experiencing symptoms. They're only for COVID patients at high risk of getting extremely sick from the virus.
So anecdotally, I think we've seen some positive outcomes with the monoclonal antibodies, but there's still a need to conduct more robust clinical trials.
UK Healthcare is one of more than 100 facilities across the state trying to ramp up distribution of monoclonal antibodies. But health experts say getting vaccinated is still the best line of defense against the pandemic. Sawyers is vaccinated but hopes the monoclonal antibodies will help her bounce back from COVID. In Lexington, Chelsea Jones for the Fox 56 10 o'clock news.
Health experts say monoclonal antibodies can provide up to 3 months of immunity from COVID-19, but they say vaccines can provide at least 8 months of protection.